I'm so excited to talk about the applied AI, or actually the AI innovation in healthcare. And I hope we can have a good presentation to just open a window in front of the people who are working in the field of medicine and healthcare about the AI capabilities in this area. I want to introduce myself. I have completed my bachelor and my master, and also my PhD in the field of applied AI in different industries. But my focus was oil and gas and mining. But right now in my company, Innovation AI, I'm trying to extend my experience and knowledge in other industries. And medicine and healthcare is definitely one of them. I not only just have the business experiences in my professional life, but also I have been involved to authoring different types of the reference books, making sure the new generation have access to some enough resources about the applied AI, and getting familiar with the new technology available in the market and how they can use it. Two books that you can see here, Advanced Analytics for Industry 4.0 and Live 4.0, is just two examples of the books that I already published. In the first book, you can find the application of advanced analytics and AI in 20 different industries. And in the second book, will be published in next July. It will be about Live 4.0. Live 4.0, talking about the human life in the age of artificial intelligence. It's something that is very, interesting topic for myself as well. And the book will be published, the first book published by CRC Press, and the second one will be published by McGraw-Hill. Okay, let's talk about enhancing patient engagement with AI, because when we talk about digital transformation in industry or in healthcare, we are facing with a revolution. We cannot just talk about technology. We cannot just talk about data. This revolution, including, the changing the culture. The culture is about processes, is about people, is about data, it's about technology, etc. So in this revolution, we need to have a 360-degree view or comprehensive view about the new potential that we have in this area. For example, we have now chatbots and virtual assistants helping doctors and helping patients to have a better understanding about their problems, and also generative AI that everybody talking about that right now, using the huge database globally, making sure doctors and patients can find their solutions or treatments quickly. So another application of AI can be AI in mental health support. AI tools provide real-time psychological assessment, offering timely mental health support to patients. Another improvement in the healthcare can be personalized healthcare apps, because now we are thinking about how we can customize our AI application based on the based on the different people health situation and conditions. So AI-driven applications deliver tailored medical recommendation based on individual health data. And it's a fantastic capabilities that AI can provide for us for healthcare. Another enhancing patient engagement with AI can be telemedicine case study. AI-powered telemedicine platforms have effectively reduced wait times, improving healthcare access. And currently, we are talking about having AI agents or virtual assistants working as a GP or virtual GP or doctor. They can receive the patient symptoms, and by comparison, this situation with the database that they have is a billion case studies, they can guess or they can predict something that will be happen for the specific patients, and that's a great opportunity. Another thing is improving treatment adherence. AI aids in patient adherence by providing reminders and behavioral insights to support treatment plans. Now we have different applications, different softwares helping us to be active in this area, but AI story, it's completely different because AI is an intelligent system. And by receiving the data, real-time data from your body, maybe by, for example, wearing the smartwatch or some other tools that we have, they can measure or body, parameters or and then they can predict something that will be happen for us in the, for example, next hour or next 2 hours or next 3 hours. And based on this, they can, make some suggestions for us for healthcare. But let's talk about AI and public health predictions. The exploring AI's impact on diseases prediction and management. The first one can be AI-powered surveillance. As a case study, for example, AI system effectively detected and contained COVID-19 outbreaks. And it's very good experience that already had using AI, or enhancing vaccination campaigns. AI plays a crucial role in optimizing vaccination efforts and tracking immunization coverage. Another thing about the public health predictions and AI application can be predicting diseases outbreaks. AI uses machine learning to analyze real-time data for outbreak predictions. And it can be useful for governments or for some organization working on the field of public health to prepare something that we need to tackle with the health issues in our community. Or maybe we can use AI for to predict some epidemic diseases, or future of AI in epidemiology is in my slide, talking about building global diseases prevention strategies and enhancing public health in overall or globally for us. And the last one that I have here is about the predictive analytics for resource management. AI assists in managing and distributing healthcare resources effectively during the crises. In overall, Industry 4.0 or Health 4.0 has 3 main pillars. The first one is about prediction, and it's the difference between AI and some other statistical models that we already used to tackle with the healthcare problems in our community. AI can give us this power to predict some diseases and some healthcare problems in our community in advance. So I'm talking about the time, and time is critical point here. If you can predict something that will be happen in your community in advance, you have enough time to prepare something, or maybe you can distribute your resources, or you can make your treatment plans for the potential patients in the future. The second pillar here is about optimization, because prediction is good enough, but we are looking for some new tools helping us to optimize some effective parameters on health care parameters, making sure we can reduce the number of the patients or maybe number of the hazards in our community in the future. So optimization, it's more important than prediction, because prediction can just help us to find what will be happening in the future. But optimization can help us to answer this question, how we can help patients in the future. And the third pillar here for AI, it's about making decisions. Previously, when we used the machine learning or normal AI or weak AI, because we have three types of the AI. We are now talking about a weak AI, and hopefully the close future will have generative AI or general AI. And we have another AI, I don't know when we can meet it, but indeed that technology, but it's about a strong AI. But during the weak AI, we couldn't have any making decision algorithms, but thanks generative AI and LLMs or large language models helping us to make some suggestions for doctors, for governments to make better decisions. You can see the effect of your decisions in advance. And AI potentially can make the list of the suggestions for you to have a better health care when we talk about the public health. So these three pillars are important, and improving AI technology from weak AI to generative AI or general AI, and later on strong AI, helping us to have a better and better public health. But definitely we are facing with some barriers to AI adoption in healthcare. So, but we need to get familiar with this type of the problems. It's not a problem, it's a barriers, but we need to tackle with them. The first one definitely is technological challenges. Key issues like data integration and computing power is some important challenges or barriers. AI works based on data. Previously, we used historical data for weak AI, and currently we are talking about real-time data for general AI or generative AI. But the quantity and the quality of data play a critical role to the AI quality outputs. We have one term here, rubbish in, rubbish out. It means that if you just feed the AI with the wrong data or dirty data, so something that you will receive is not clear and it would be really confusing. So you need to make sure you have access to the, the cleansed data and removing all outliers that you have, and also making sure you have the robust computing system to run the algorithms in a perfect manner and then receive the right maybe outputs, or outputs can be prediction results or optimization results or making decision suggestions. Another barriers for AI adoption in healthcare is about ethical and legal. So when we are working with patients, we need to collect the data from human. And in many times, patient privacy concerns and biases in AI models create significant barriers for us. When you want to develop AI, for example, in oil and gas or aerospace or in mining area or some other industries, you need to collect data from machines or from processes. But in the health, the story is different because you need to have access to the very private information about the people. So we need to have ethical and legal, rules and conditions, making sure AI can consume this data in a right way. Another barrier can be the resistance from healthcare professionals. Job security is important for all of us, for doctors, for nurses, for all the people working in the healthcare, all right? So, and sometimes people think about how AI can replace them with machines and it's a very important point because definitely AI works very well in the field of data comparison, making suggestions, and having some consultancy services. So maybe later, some people working in the surgery areas or maybe doctors having, some handy activities, they have a safe margin or safe area, but it's just for now. Maybe robots technology or robotic can replace with the people in the close future. But currently we are talking about general practitioners who are making some suggestions for patients and give them some advices based on their the patient information and data. AI can work perfectly in this area and can be replaced with GPs, and it's very important. But how we can tackle with this issue? My suggestion is two things. First, training the current doctors and asking them to pass some maybe related courses, AI courses or advanced analytics courses, making sure they can use this AI technology as a tools perfectly. And the second one, having some new related courses in the university curriculums for the new doctors coming to the market, making sure they are aware about the benefits of using this technology, and they know how can use this technology in the right way. Another barriers to AI adoption in healthcare can be the importance of transparent AI governance. Transparent governance is essential to addressing regularity complaints, and I have many case studies in this area. Maybe later I can explain for you, but it's important for us to think about this transparency in AI governance. And it's important for us to not use AI as a black box, because normally AI receive the data and give us the outputs. The outputs can be some suggestions or, or maybe prescriptions for the patient, etc. But it's important to know what is happening inside the AI and how AI can digest this data to make some outputs for us. Another thing is integration. It's important to have the structured approach is needed specifically for a more AI integrated healthcare ecosystems. You cannot use AI just to solve one piece of the problem in the puzzle of healthcare, because you need to be in contact with other sections. And it's a very comprehensive and integrated approach that you should have in your plan when you want to have the digital transformation in healthcare or AI adoption in healthcare. So when we talk about the innovations in AI transforming in healthcare, we need to think about something that I mentioned here in this slide. The first of all is emerging AI technologies. Generative AI, quantum AI, and federated learning enhance secure data sharing in healthcare. Another point that is important is robotic surgery advancements. AI-powered robotic surgery offers precision medicine and automated diagnostics, improving outcomes. But maybe we are a little far from that, but I believe that technology is growing very fast. And in the close future, we have some robots can complete the surgery for us perfectly. Currently, we are using robots just to help some doctors in the surgery, but it's just working as a tool or giving us some better information or knowledge about the collected data, or sometimes using video analysis or picture analysis to detect some anomaly in the body. But in the future, we have the robots to have a fully automated surgery. Another thing is about AI in research. Definitely AI-driven research is accelerating discoveries related to, the age-related diseases. And also in the bridging health data gaps, AI facilitates connections between genomics, proteomics, and precision health for better treatments. So we know that, the DNA of different people are completely different. So, and the effect of some medicine can be, or drugs can potentially be different in the different body. AI can adjust the drug or medicine effect with the people DNA, making sure we have the better treatment or optimize or treatment processes. So let's talk about transformative AI applications in healthcare and exploring AI's impact on patient care and efficiency. The first one is AI-driven early diseases detection. It's very important. AI technologies are utilized for early detection for diseases, significantly improving patient outcomes. And it's important because if you can predict something, if you can detect something in advance, can help you to have a better time period, to make a plan for the treatments. AI assistant radiology advancements. I mentioned something, but definitely now we are a radiologist using AI assistants, and we have some very strong tools, AI-based tools for, you know, um, pictures analysis or photo analysis by AI. And the AI in just 1 second can compare the patient radiology photos or images with the other patients that they have in, their database, and can help radiologists to have a better understanding about the potential problem that we have for the patients. Another one is about the revolutionizing drug trials with AI. AI facilitates virtual patient simulation. It's very, very important to reduce risk associated with experimental drug trials and enhancing safety. Now we have a different startups working around the world. One of them is Vivo, for example, in Cambridge, in London, and they are focusing on using neural network to find the effect of new drugs on different people. Or I can see they can simulate the patient's body conditions when they consume one type of the specific drugs. And it's important because if you want to develop the new drug, you need to test this drug on maybe more than 1,000 people, and you need to complete very statistical and complex analysis, making sure this drug can be useful in the future. But now we have the virtual patient simulations applications, and you can complete all your tests on the digital twin by using digital twins. When talk about the digital twins, it means that we are simulating the body of the patients by computer, and everything that will be happen on the body can virtually simulate by computer, and you can see in your system. Another one is EHR automation to combat burnouts and the lessons learned from the AI implementation. Healthcare institutes share valuable insights from AI implementation, paving way for future innovations. As an AI specialist and working in this area now for more than 20 years, I'm very confident that we can have the AI tools practically in healthcare very soon. Because a main challenges in other industries or other areas that we want to deploy AI models is data. But for hundreds of years, we collected a huge amount of data from hospitals, from laboratories, from universities, from research centers, and now all of them are available, and the main part of them are free and is open source. And you can use them to train our model, because the big challenge for us is training our AI models, and training happen based on the data. If you have enough data, I'm talking about the quantity and quality, definitely you can have the better AI algorithms and trained models. So let's talk about the transformative impact on AI in healthcare. The first one is AI's role in predictive analysis, that we already talked about that. It's very important to have the prediction. The second one is sustainability through AI. AI fosters sustainability initiatives, improving resource management in healthcare environments. Personalized care revolution. It's very important because we have different people with different characters, different body characters, different DAA, and we can have a specialized or maybe customized treatment plan for each people individually. Responsible AI adoptions. Ethical consideration are crucial, and ensuring responsible implementation of AI in healthcare is important. Balancing automation and expertise. AI should complement human expertise, enhancing the decision-making processes in medical settings. We talk about that as a third pillar of applied AI in medicine and healthcare. We talk about making decision algorithms, and the role of virtual assistants to make a better decisions is completely clear. Investment in AI research, we need to encouraging, investment or investors working in this area, because AI is good enough to invest, but the problem is returning the, in the budget. Sometimes it takes time, and normally AI technology, it's very expensive. Maybe in the future, having, the quantum computers and having the better computing system or cheaper computing system can help us to reduce the cost of AI, but currently AI is expensive. So it's good in the one side because can help us to support humans having their job and secure their job. But in the other side of another side of this coin, the huge cost of developing AI can slow us to have better improvements in this technology in comparison with other industries that their revenue margin is huge and they can invest in this area. Collaboration among professionals, AI play a critical role here. It's very important for here because AI potentially can make the better collaboration between different professionals globally. And they can make a comprehensive consultancy services to solve the patient's problems. Ongoing education and policy development, continuous education and adaptive policies ensure that healthcare professionals stay updated on AI advancement. We talked about that before. We talked about changing the curriculum at the universities for doctors, and we talk about the training sessions for the doctors who already graduated from universities. Regularity adoption for AI is important. And the last one is AI's potential in global healthcare. AI has the potential to reshape global healthcare delivery, improving access and efficiency of services. So it's the end of my presentation here, but I really like to emphasize again, we are facing with the revolution in healthcare, specifically when we talk about the global healthcare. We cannot, just make a difference between the developed country or underdeveloped country. AI can use all of the collected data, globally data, to make some, maybe sometimes, the global plan for having this type of the technology. But we definitely need support from governments, from investors. We need some researchers who are working as a unicorn. I say unicorn because we have many prestigious universities around the world, same as MIT, Oxford, or some universities in Canada, everywhere in Australia. They are providing some IT services, and they are delivering some related courses for IT and data science, data engineering, data architecture, data cybersecurity, etc. But they don't have enough information and background about health, about medicine. In another side of this challenge, we have very good universities providing, the educational services for doctors, and they are, educating some new generation of doctors, but the doctors coming to the market don't have information about data analysis and AI application. So the combination of these two majors are very important. We need some people who have data background and also medicine background to have a better healthcare plans in our country. So this combination is important, but my experience showed that by adding some new courses at the universities and also forcing the current doctors to pass some educational training programs during their work can help us to be aligned with this new technology in healthcare and medicine. We are in the beginning of the way, but we need to make sure the growing technology in our community and in our healthcare area is aligned with the growing rate in other industries. Because now we can see the AI applications in other industries and they are using perfectly this technology. But in healthcare, we need to work harder than now to make sure we have these new technologies perfectly in the close future. Thank you so much for your time. I really appreciate giving me this opportunity to talk about AI applications in healthcare. Thank you.
Thank you so much, Ali, for your wonderful presentation on AI. That was really insightful for the audience. Just a few questions, like, so especially in the healthcare sector, like, in the clinical trials. So what would be the regulatory hurdles that we can see? Because the regulations we have from US FDA or the European Union is a little bit stringent. So what would be the impact of these regulations on the usage of AI, especially in clinical trials?
Yeah, if I can understand, you're talking about the effect of AI in the current situation, healthcare?
No, the regulatory challenges in the clinical trials when we are using the AI.
No, we are facing with the different challenges. Some of them I mentioned in my presentation as barriers, but I believe that one of the key point here is training. Or doctors have not been trained to use AI perfectly. Now we have many applications, AI-based applications, and doctors using them. For example, my wife is a GP, she's a doctor, okay? And to complete the report for her patients, she used AI, but the application listened to the patient and doctor's communications and then try to make a report. But, sorry, based on the lack of the regulations, this data will be distributed in the app, and the app owners can use this information to train their model for other patients. So it's the against on the policy that we have for ethical issues, you know. So we need to train doctors, and also we need to send this message to patients that this technology can help us to have a better and sooner treatment plan for their problems. So I believe that the contribution between humans and AI, it's not good right now. And we need to work in this area. We need to give more knowledge, information to both of the doctors and patients, make sure they are aware about the benefits of the AI. So it's important. And another challenge that we are facing with that is the cost of this type of technology in healthcare. And we need to encourage government to invest in these areas as well. So for data, I'm sure that we have enough data. We don't have any data scarcity problems to develop the AI technologies. But yeah, human machine contribution, investment, and the cost of these treatment methods or using AI are some of the big challenges that we are facing with.
Great. That answers the question. Yeah. Thank you so much once again, Ali. That was really a wonderful presentation. And if any questions from the audience, they can put up. Otherwise, they can send us an email and it will be forwarded to Ali, and he is the best one to answer.
Yeah, thank you so much for giving me this opportunity. And just if the guys just Google my name, they can find my email address, telephone number, everything. And please keep in touch if you have any further questions. Thank you so much.
Sure, definitely. Thank you so much.
Thank you. Have a good one. Bye.
You too.